It's showtime.
People should not be afraid of their governments. Governments should be afraid of their people.
You know, the right to bear arms is because that's the last form of defense against tyranny.
Washington is fundamentally corrupt. There are more words in the IRS code than there are in the Bible.
Made in America, heard round the world. You're listening to Blunt Force Truth. I'm Chuck Woolery, along with my co-host, Mark Young. We have a great guest today. I can't wait to get to him. But in the meantime, I think Mark's got something on his mind.
Chuck, I'm going to tell you what we were talking about. I'm going to bring this up because it's something that was off air. And by the way, today's guest is Kevin Wacasey. He's an MD from Texas. And we're going to talk about health insurance, or the disaster of health insurance.
Yeah.
And how we probably don't need health insurance. But what we were discussing, Chuck, I was going to bring this up really quick, was marriage licenses.
Yeah, we were talking about this off air, and you said something I'd never heard before. I was shocked by it. In fact, I just passed it on to a close friend of mine, and she said, well, I've never heard of that either.
So here's the scoop on marriage licenses. Marriage licenses did not exist before the Civil War.
I didn't know that.
So but you do remember this, though, not that you were there, but you'll remember hearing this. Marriage records, when you go back pre-Civil War, marriage records are all where? In the churches.
Right. Mm-hmm.
You go to a church to find a birth certificate, a death certificate, and a marriage certificate.
Right.
The reason was because a marriage was a religious ceremony.
Mm-hmm.
It was not a binding legal
ceremony.
contract. It had nothing to do with the government.
Right.
So after the Civil War, there was a horrible thing happening that the Democrats couldn't live with.
And that was?
Black men were marrying white women.
The fear.
So the Democrats started, down in the South, marriage permits. So you had to go and get a permit to be married. And therefore, if you were not the same race, the county, the state could reject your permit to get married. It was the Democrats stopping black people from being able to marry white people. Now, this started spreading. It started in cities and counties. Then it started spreading to states. And once states started adapting it, the federal government decided it was time for them to get in on the fun because, anything that can make money.
Right.
And more importantly, it made it so they had control. So prior to the Civil War, when you got married, it was a marriage between you and your wife and God. Now your marriage today is between you and your wife and the government.
This is an interesting evolution that the Democratic Party has made, because now it's to the point where you can marry your pet goat.
Okay, we already talked about this, that you were a goatophobe because you were attacking goats. You're goatophobic.
Is it possible to marry him?
I don't know. So, and then if you have kids, does the goat call you Dad?
Dad. Where's Mom?
You remember Goat Boy?
Oh, Goat Boy was awesome. I mean, he would talk normally, and all of a sudden he'd go, it was great. I couldn't even do it.
We need to bring Goat Boy back.
Goat Boy was awesome. I love Goat Boy.
Well, we're not going to have Goat Boy on the air today, but we do have somebody better than Goat Boy. We have Dr. Kevin Wacasey.
Yes.
This is the first time you've ever been compared to Goat Boy, I'll bet.
He didn't compare.
I'm sure not the last.
We will not refer to you as Dr. Goat Boy, I promise.
Thank you.
Kevin has a practice, and you are in, where was it, Fort Worth, Dallas area?
Yes, Fort Worth, Texas.
And are you a GP?
Well, I was trained as an emergency physician, but 6 years ago, I walked away from all of that stuff, the health insurance, the hospital setting, decided to set up my own, what we call today concierge medical practice. But I don't take health insurance. And so I call myself a general practitioner or a primary care physician. I'm not a family medicine doctor, but I function in that regard.
And how do people pay you? You obviously have to get paid.
Oh gosh, we take cash, check, and credit cards, Chuck.
Okay,
but no health insurance.
Bitcoin, S&H grains, grease stamps, whatever. You could possibly come in and pay with some goats, maybe.
Yeah, goats, chickens. I mean, if you got a good recipe for a goat, I'll take it. Yeah. But the bottom line is, what's really interesting is this is a movement across the nation now. It's called direct primary care. I prefer the term direct patient care because this doesn't have to be limited to primary care. You know, you and your internist, your family medicine doc, your pediatrician. There are surgical centers now popping up around the country. The Surgical Center of Oklahoma, you guys ought to have Keith Smith on sometime if you'd like to speak to him. He's great. He's the founder of the Surgical Center of Oklahoma. It's a nationally and internationally known center where people can fly in there, and all their pricing is right there on the website. You want to know what it costs for a knee replacement? It's right there.
So let me ask you this. You kind of fulfill the role, if you will, of a primary care physician, correct?
Yes, sir.
So I'm signed up with you. I probably live in the Fort Worth, Dallas area, correct?
Sure.
Or you have patients outside you don't have patients way outside your area, correct?
No, not generally speaking, no.
So it's a local kind of thing. Okay. So I sign up with you for whatever it costs. I guess we can talk about that later. And I have another problem. Like you say, you know, I need for you to see so-and-so because I had a doctor in LA and he was a fabulous doctor. Everybody would say to me, oh, you're so lucky to have Les Dornfeld as your doctor. He's a great doctor. And so I asked Les one time, I said, why does everybody say you're such a great doctor? He said, it's not that. He said, I know everybody. I know the best doctors in the world, and I can get you to them if you need them where other people can't. That's what my value is to you. So the interesting thing is, and he, by the way, did that and basically saved my life. But the interesting thing about that is so you have a primary care physician. Now, you have to say, well, you know, this is really not my field here. You need surgery, or you need to see this guy about this and that guy. So you have a list of doctors, I suppose, outside of your web, correct?
Absolutely.
How does my cost affect that, or does it? Or do I have to pay separately for those as well?
Can I give you a scenario? I have one patient of mine. He's in his mid-50s. I just turned 50, so I'm not going to bash him at all. But he's in his mid-50s.
We all turned 50.
Well, it's better than not turning 50, I suppose. But on December 31st, now I do concierge practice. He pays me an annual fee. And I am on call for him 24/7. And I don't charge him for consultations. Now, if I have to do any procedures or give him medicines or anything, I'll do it. But he can come in and see me for free, unlimited office visits throughout the year and calls. So on December 31st, on New Year's Eve of 2017, this gentleman contacted me at 11:35 p.m. And I was at a party. He was not. And he said, I'm really sorry to bother you, but I'm sick. I said, what's going on? And so the symptoms he described to me were something called diverticulitis, which is a bad condition. It's a very serious condition involving the intestinal tract. It's where the intestines get infected, the large bowel, the colon. And let me tell you something, 100 years ago, this would have been fatal. I mean, without antibiotics, this guy would have been dead over a course of a few days, in agonizing death. But the good news is nowadays we can treat this with a course of antibiotics. And so I said, look, I want you to drop whatever you're doing. He wasn't doing anything except laying in bed. Go get these 2 antibiotics, start them right away. Then I'm going to contact you tomorrow and see how you're doing. Then I'm seeing in the office on Tuesday, the day after New Year's. He came in. It saved him from a hospitalization, saved him from an ER visit. I mean, this guy just saved all kinds of money. He is a self-employed individual, and he has got a $5,000 deductible on his health insurance plan. So you could say that I saved him at least $5,000, if not more than that, just with that one potential visit. So then I had to send him, and this spurred him actually to go get his colonoscopy. He hadn't gotten it. He was a bad boy after 50. So this finally spurred him to go get his colonoscopy. This previous New Year's Eve, just a few weeks ago, he contacted me again on December 30th, not New Year's Eve. He said, look, I've got a urinary infection this time. So I said, okay, here's some antibiotics. You're going to stay out of the hospital. We're going to keep you out of trouble. I want you to go see a urologist this time. So he went and saw the urologist afterwards. This was just last week. And it turns out he had a major prostate infection that had swollen his prostate up and kept him from urinating, and that's what led to the urinary infection. So the way I work it is, yes, I do have to refer to specialists from time to time. I try to take care as much of it as I can, but sometimes they have to go see specialists. And in those cases, what I've done is I've established a network of specialists who are willing to work with these people to take cash. And I don't mean that you have to pay them in cash. What I mean is you can pay them directly. You don't have to go through your health insurance. And so, for instance, there's a cardiologist, a single practice cardiologist in Grapevine, which is a suburb near me. And
Grapevine, by the way, Grapevine is very close to Dallas. And
Yes.
it's his area, it's Grapevine, Texas. Yeah.
Yeah, it's a wonderful area. There's a single practice cardiologist up there who will see my patients for $150 for an office consultation to do a stress test on people, get them on a treadmill, look at them. It's $300. I think his price for doing a nuclear stress test is something along the line of $800, which is, a lot of money, but it would be thousands of dollars if you did it through your health insurance plan.
I've done it.
So, yeah, good. I'm glad you have, because that's
But back then I had SAG and AFTRA, and I was covered, completely by my great insurance through the Screen Actors Guild. And now, of course, I'm on Medicare like everybody else over 65.
Right.
So now I don't.
So Kevin, when you're with a patient, so the average doctor spends 6 minutes with a patient.
Mm-hmm. Is it that long? Really? Have we gone up?
Yeah, 6 minutes is the average.
Okay.
Now, the first thing I want people to think about is, after I say, hi, how are you? Things are great. How are you doing? How's the kids? I'm down to 4 minutes. And in 4 minutes, I'm going to diagnose what's wrong with you, and I'm going to get to know everything about you.
Right. I'm
going to find out, tell me about your exercise. Tell me what you're eating. Tell me what kind of problems you've had. Did your parents alive? What did they die from? I'm going to do all that in 6 minutes and being able to diagnose you, or 4 minutes that I have left. It's a ridiculous concept.
Absolutely. So I like that.
You're just talking about what he's going to do as a doctor. What about the patient when he says, well, describe your symptoms? Well, this is what happened. Yesterday I went out to the store. That's a 5-minute story.
That's right. That's right.
So you don't spend 6 minutes with a patient.
Oh, I as I say on my marketing material, often my patients have to go before I do, because I love to talk, and you guys will find out later. But I'm telling you right now, there's 3 things missing from healthcare these days. That's affordability, number one. This direct patient care that I'm talking about solves that. There is customer service missing from healthcare. Direct patient care solves that. And believe it or not, there's consumer choice missing from healthcare, and direct patient care solves that. And what I mean by consumer choice is, if you hear that somebody down the road had thyroid disease or something, or died from an aortic aneurysm, and you just want to get checked out for it, good luck under today's traditional health insurance system, because you're going to have to go to your doctor. You're going to have to beg and mother may I. The doctor's going to say, are you having any symptoms consistent with this? We say, no, I'm just curious. I don't want to drop dead from an aortic aneurysm. Well, since nobody in your family's had one and you've never smoked, the likelihood of it is low, but, we're not going to order the $6,000 test on you because your insurance won't pay for it. And even if your insurance covers it, then, you're still got your high deductible plan, so you have to pay for it. Well, these aortic aneurysms are found with ultrasound screenings that can be done for $50, $75, $100. I have a tagline that I like to use. It's not the costs of healthcare that are outrageous, it's the charges.
So here's my story.
Yes, sir.
I had an aortic aneurysm.
Wow.
My father died of an aortic aneurysm, and I can remember back in the 60s when he died in Ashland, Kentucky. No one really knew what it was. It's just that his belly had filled up with blood.
That's right.
But nobody really, I can remember going through life saying, I don't really know what my father died from. That's what it was. So I have this 4-way bypass, and I have this intrusion to take a look at what's going on in my heart. And my doctor says to me, I'll tell you what, Chuck, you got an aneurysm on your aorta, and we need to take care of that sometime, but I can't do both procedures at once. Mm-hmm. So we'll watch the aneurysm, and we'll do the 4-way bypass, and then we'll keep an eye on the aneurysm. So now I have a little break in time between shows, and this is the absolute truth. I go to see my doctor, and I say, I got this time. I'm going to volunteer to go in for this aortic aneurysm surgery, whatever it entails. I didn't know. So I'm going to volunteer to do that to get it out of the way, because we're going to have to do it sometime, right? Yes, right. We are. Okay, so I go in and do it. It's far worse than a 4-way bypass. At that time, it was extremely brutal. Invasive. I had no idea. So I go through this. Well, I get out of the surgery room. He comes in and talks to me after my surgery. He said, Chuck, I could not recognize this through any other way than to tell you it was paper thin and could have gone at any minute. Mm-hmm. So
yeah. And
now this guy's like one of the great experts of our time and one of the best in his field, and he still couldn't catch it, even through ultrasound and everything else. It was, he knew it was there, but he didn't know how extreme it was.
Well,
Now that's been I don't know, 20 years ago, 18 years ago, something like that. Have things improved since then?
oh my gosh, yes. Oh my gosh. And in fact, Mark and I had talked on another podcast about this book that I'm going to write. It's called Your Money and Your Life. I've already written a couple of books. They're not bestsellers though, but this concerns the idea that we have all of this wonderful, outstanding technology that exists, these ways of finding disease, the ways of treating disease. The technology to treat aortic aneurysms is now an outpatient procedure, Chuck, in most cases.
Are you serious?
Yeah. It's not what you went through, that brutal,
I was cut from the top of my pubic hair to my chin, to my rib cage.
Yeah. In most cases now, what they do is they go in with a stent, which is a plastic tube. They stick it in through an artery in your leg via an intravenous needle, what's just a large intravenous needle. They slide it up into position. They inflate it, if you will, anchor it, and then voila, you wait around a few hours to make sure there's no bleeding or infection stuff, and you go home. And it is an amazing, amazing procedure. I've seen it in action. My mother went through what you went through back in '96. And if she were around today, we would be talking a wholly different story. So we have this outstanding technology. And for this reason, I think that aortic aneurysms ought to kill, 0 Americans every year, because we have the ability to find this with a simple ultrasound that doesn't cost much at all to do. And these things are very slow growing. Yours, you sat on for a while until, it was paper thin. I agree. It could have blown at any time. It's very dangerous. But if you catch these things, they're pretty predictable in how they grow. And we can be fixing these things. And my whole take on this is that health insurance, I'm not against health insurance per se. I want to be clear about that. I think that health insurance is a very good thing to have for unexpected catastrophic events. But you said something earlier, Chuck, that I want to zone in on. You said, I had great health insurance through SAG, through the Screen Actors Guild. Well, define great health insurance. What does that mean? Does it cover doctor visits, flu shots?
Covered everything.
Yeah, well, that's not health insurance. That's prepaid health care. And that's where we start getting very, very expensive. If you're paying, in my first book that I wrote, it's called The Guide to Buying Health Insurance and Healthcare, I compare health insurance to Vegas, to go into Vegas. And if you pay a company to take on all of your risk, and I mean all of your risk, you're going to pay that company a lot of money. And that's why we see health insurance premiums these days that are bigger than mortgage payments.
And they are huge, aren't they?
Yes. And it's because...
And this is, let's narrow in and make it political, because it is a political thing. The Democrats got involved in this with Obamacare. They passed it with no Republican votes.
Right.
It's a mess. It's an absolute mess unless you're getting it for free, correct?
That's right. If
you're getting it for free, it doesn't matter. Then everybody loves it because it's free. But if you don't get it for free, it's terrible. My wife has it. It's terribly expensive.
Yes.
It encroaches, and she can afford it, but she doesn't like it.
Yeah.
And the point is, they pass this, it's a mess, and then they blame the Republicans for not fixing it.
It was the perfect political setup. Perfect political 1-2 punch that the Democrats did with the passage of the Affordable Care Act. I'll say this, though, and I point this out in my first book, that the Affordable Care Act, why it came around when it did, is really an interesting story. And all of this is related to politics, okay? We wouldn't have our healthcare system that we do today and health insurance system that we do today without the political intervention. People talk about how government is so involved with healthcare in socialized medicine countries like France and Germany and England. Oh, the government's very involved with healthcare here because it has passed laws. Do you understand that in this country, if you go to the doctor, it used to be you'd go to the doctor and pay a $5 copay, and that was it. That was all you paid. Nowadays, you go to the doctor, you pay a $20 copay, and then a few weeks later, you get these bills from the hospital, the doctor, the pharmacist, the nurse, the guy who cleans the carpets on the Saturdays. He sends you a bill. And so you're wondering, why am I paying all this? Well, you're paying that because you have a high deductible. That's what's changed with health insurance. It has now it's morphed from a prepaid health care system where you only paid a $5 copay into a true insurance system where now you pay something up front that's piddly, but then you're not covered. You have a high deductible. And that's a very sneaky move that the insurance companies did. So, and I'm going to circle back to the Obamacare thing, I promise. But what happened during the 70s, 80s, and 90s with the advent of managed care is it got everybody addicted to health insurance. And America does have an addiction to health insurance covering all their stuff. The problem is that gets so expensive, and I liken covering all this stuff, it just gets so outrageously expensive for these health insurance companies that they can't afford to do it anymore, so they have to start pulling back. And I make this analogy in my first book. It's a rather crude one, and I do apologize, but it works. And that is, if health insurance companies are like drug dealers, the first key is to get everybody addicted to your product. And they did. They did it through the passage of the Health Maintenance Organization Act in 1973. That's a law that needs to be repealed as bad as, if not more than, Obamacare. Because you know what the HMO Act did?
What's that called again?
The Health Maintenance Organization Act of 1973, the HMO Act.
You would know it as HMO, Chuck, when you hear people say they have an HMO.
Correct. What that did was it allowed health insurance companies to get away with something that no other industry, to my knowledge, in this country can get away with, and that is restricting your consumer choice by telling you you have to go to these networks or else they don't get paid for. It restrains my trade as a practitioner of medicine because I have to see these patients per the terms included in the insurance contracts.
Now, who was behind that HMO kind of thing that in the 70s? Who was behind that? Do you know?
A Republican, Richard Milhouse Nixon, is the guy.
He was the
So it goes on both ends.
I'm not a crook.
I'm not a crook, right? There's an interesting, I'm not a big fan of Michael Moore, and I would say that you guys probably are not a big fans of Michael Moore.
And he is not a fan of ours,
And that's okay. But Michael Moore came out with a movie that is really sick, and 99% of it is really sick. It's called Sicko. Mm-hmm. And one of these days, I'm going to do a rebuttal line by line to that whole entire movie. But there is one scene in there that is fascinating and where he is right on point. And he actually has an audio clip of the Nixon tapes. And you cannot find this online. I've looked at it for forever now online. I can't find it in the Nixon tapes. They must have scrubbed this one part where he's discussing with one of his policy advisors, and the advisor is telling him, I had Edgar Kaiser come in and talk to me about this health maintenance organization plan he's got up his sleeves. And Nixon says, these damn health organizations, I don't like them. And the guy says, oh, no, but this one's different. This one's based upon profit. And he said, the less care they give them, the more profits they make.
Kaiser Permanente.
Right, exactly. And Nixon's like, oh, that sounds appealing to me. It's really disgusting.
I like that.
Yeah. It's really, really disgusting to hear these two, top dogs in the U.S. government talking about this and wringing their wrists and slathering. And it's like managed care should have ended that day. That should have been the end of it. But no, it's gone full steam ahead. And let me tell you the most pernicious thing that managed care has done for people, and they don't even realize it. Again, this is all with the government's help. It's price fixing. In other words, when you had a $5 copay and you went to the doctor, who cares what the price is? I don't care. I got my $5 copay. I don't care what it really costs because my health insurer is paying for it. Well, now that you have a $5,000 or a $10,000 deductible, you're paying for most of it. And what that really means is that you're now paying a price that you had no part in negotiating. Because when you go in and you say, and this happened to me, I had a colonoscopy. I had my 4th colonoscopy a couple of years ago. They're fun. I recommend them for everybody.
I do one every other week. Yeah.
Okay, we need to talk, Mark.
I'd like to introduce you to a new type of podcast. And by new, I mean there's never been anything like this before, not in terms of scope or ambition. The show's called Living Beyond 120. Science proved that lifespan could exceed 120 years back in the 1960s. And the Bible first mentioned living to 120 years 6,000 years ago in the book of Genesis. But the question is, how do we get there? Living Beyond 120 tries to answer this question. The show is an exploration into human longevity and what it will take for us to live longer, healthier lives, featuring interviews with some of the most respected minds in longevity science and tackling big subjects like how the medical system, big pharma, and maybe even our own government don't want you to live longer. Living Beyond 120. It's hosted by me and my co-host, medical expert, Dr. Jeffrey Gladden. You'll find the show on iTunes, Stitcher, or your favorite podcast directory, and you can also listen to it at the website livingbeyond120.com.
But the bottom line is that I go in, I have a $5,000, whatever, deductible on my policy now. And I go into the facility and they say, okay, your facility fee is going to be $658. And I said, wait a minute. Why am I paying $658? Can I talk you down? They said, no, that's the price we negotiated with Blue Cross Blue Shield, your insurer. I wrote a blog piece about this. And I said, wait a minute, I didn't negotiate that, but you're saying I have to pay it. Now, in any other industry, guys, this would be called price fixing, and it would be illegal. It would be front page news. But in healthcare, it goes on all the time, and it's thanks to the United States government.
Well, let me ask you a question. Besides for price fixing, isn't health insurance, wouldn't the more better description be that it is a health rationing system?
Well, again, first of all, we have to differentiate health insurance from health care. That's one of my pet peeves. I have a Twitter account, and one of my giant things is pointing out, I call them turkeys every day, reporters, politicians, policy experts, all these people who say healthcare, that we're increasing access to healthcare. Now you're talking about health insurance. So I want to make that distinction. There's a really big line between health insurance and healthcare. So when it comes to health insurance being a rationing racket, well, of course, these are for-profit companies, and I like to say, as I point out in my book, they're much more beholden to their shareholders than they are to their policyholders. And so the interesting part of that is that's even transitioned, though. Let's talk about that and what Obamacare did to that model. From the 70s until 2010, when Obamacare got passed, what happened with health insurance was it made its money largely by being restrictive through a managed care approach. This explains how you would go to the doctor and they would order an MRI on you or what have you. And then you'd have to go and beg the permission of the health insurance company. And they would say, well, you don't look like you have whatchamacallitis, so we're not going to approve that MRI. And that was how they saved money, by delaying and or denying health care that your doctor wanted you to have. And that still goes on in a lot of cases. Don't get me wrong. That model hasn't disappeared. But the health insurance company, since Obamacare, and I did a video about this on my YouTube channel, you guys should check it out. It's called Why is the price of my health insurance? Why does my health insurance premiums keep going up? And it has to do with the little provision in Obamacare called the medical loss ratio. And this is where the fine folks who wrote Obamacare said that a health insurance company has to pay out 80% of what it takes in healthcare claims. Now, let's break that down. Let's unpack that. If I have to pay out 80% of something towards a healthcare claim, that means I get to keep 20%. And that means I'm now working, if I'm a health insurance company, I'm basically working on commission. And who in your right mind is that you've ever heard of who works on commission and wants to drive those prices down? Nobody.
Right, because the more I pay out, the more the 20% is, because I can raise the premiums.
That's exactly right. And that is why you hear about nowadays. So this is a different money-making model from the restrictive thing of managed care. So now you hear about these claims that are being paid for, $8,000 for a bottle of lotion that has aspirin ground up in it. $4,000 for, a bandage at an ER visit. And the health insurance companies pay these outrageous claims. And you're scratching your head that, the outside observers are going, why are they paying these? It doesn't make sense.
Did you just say a $4,000 bandage? I mean,
for an ER visit.
Or is that real? A bandage?
Oh no, I can show you bills. Yeah, I've got news articles about this.
Think about a CAT scan. Insurance will pay $1,300 for a CAT scan or an MRI that you could walk into a walk-in clinic and pay $300 in cash and get done.
That's right. One of my patients, in fact, he needed an MRI. And so he's a car dealer. He owns a car dealership, and he has a high deductible plan. So I got a fax from this place in Fort Worth last week and said, now through January 18th, get them while they're hot. MRIs are $225. So it just so happened he wanted an MRI. I called him up. I said, hey, go get this MRI this week before Friday. It's $225.
Sale on MRIs.
That's right.
He should make it part of his car wash. MRI, get a car wash.
Well, that's the difference is car washes and cars are subject to free market forces. Healthcare in the United States has really, since the advent of what I call modern healthcare, I point this out in the book, since we went from paying with chickens for the leeches that the doctor prescribed and the bloodletting and the cupping stuff, before there was real healthcare, ever since the advent of modern healthcare after World War II, it's not been free market forces. It's been subject to these third-party payer systems, i.e. the government and or health insurance plans.
You know, problem I've got with that model, if you think about it, as practitioners, you work for the person who's paying the bill.
Ultimately, yes, that's right.
So if you're working, if Medicare or an insurance company is paying the doctor, then the doctor technically isn't working for the patient. The doctor's working for the payer.
That's right.
So the doctor's not in the position of being able to recommend what he wants. He has to prescribe what his boss, the payer, is willing to provide.
That's right. And the screwy part of this, the crazy part of this is that consumers just don't get it. People have been so brainwashed by...
I agree with you. They don't get it.
It's what I call in my book the big myth of healthcare, and that is the idea that we need health insurance to cover healthcare, and I mean all of healthcare. I can't tell you how many conversations I've had with patients where I say, look, if you just go pay directly for this medicine, it's $10. And my patient will go, well, I got a $10 copay. Why shouldn't I use my health insurance? And I'm like, well, A, you're going to file a claim on your health insurance, which you would never do voluntarily with your car insurance. But B, that $10 copay through your health insurance will get you 1 month worth of this medicine. Through my method of $10, you'll get 3 months worth of this medicine. You interested? And it's just getting people off this mindset. It's what I call busting the big myth of healthcare that's going to change healthcare. In fact, the last few paragraphs of my first book, I talk about this, that doctors can scream all we want to. We can get together as hundreds of thousands of us and collectively pass gas, and it won't do anything except smell bad for a few seconds. What is going to fix this? It's not the government. It's not policy experts. It's certainly not hospitals and the medical care or health insurance establishment. What's got to fix this is people. Once enough people start recognizing that, hey, it's up to me to act like a consumer. Once they start acting like that by the tens of thousands, hundreds of thousands, millions even, it's going to happen. And, you know, this is something that President Trump recognizes. And he's putting forth some great stuff. Go ahead.
Psychologically, that's a real boundary that most people won't cross. And I'll tell you why. And you know why.
Yeah.
Because it's a position of authority, of education, of just, it's impossible for the average person to go up against what they believe is going to heal them, help them, the expert in the field that they didn't study for, so they have to. It's a matter of trust.
That's right.
And it's very hard to break that trust.
And the problem is they put their trust now in the wrong entities. They're trusting the government.
Every day. I mean, we're putting our trust in not having a wall. We're putting our trust in not having voter ID. It's ridiculous. It's stupid, but that's what we're doing. It makes no sense.
Chuck, let me give you another example, and we'll get Dr. Wacasey's opinion on this. This is something that Jeff and I talk about, and that is when we talk to a traditional medicine doctor, most of these doctors, private practices are being wiped out, and most of these are being moved into managed care systems, into healthcare systems. When the doctors do their CMEs, when the doctors do their annual training, their additional training, the training's being set up by the doctor group, the hospital group. And what these doctors are being trained in is what's the latest thing approved by Medicare and approved by insurance. Now, here's the difference. The difference is simply this. You go to your doctor, Chuck, and your doctor says, well, we've got this new prescription. Chuck, you've got this stomach problem. This is the latest prescription we have for your stomach problem. That latest prescription that he's showing you is probably, and Dr. Wacasey, you can weigh in on this, it's probably, 10 to 15 years old?
Well, what's even scarier is the drug companies will take two medicines and combine them, and then it's thousands. I've written a blog post about this that's really interesting. It's called Meet Martin the Martyr, where I talk about Martin Shkreli, how he got into trouble for jacking up the price of an AIDS drug. Well, compared to what other companies are doing, Martin, who's now in prison, is a downright amateur.
Hiker.
Yeah, because these other companies, let me give you an example. There's a medicine called Diclegis, and it is a combination of the oldest antihistamine around that's been over the counter for decades, since before I was born, and vitamin B6. These are two over-the-counter medicines. It's $60 a tablet.
Because they threw some niacin in it?
Nope. Those are the only two ingredients. They combine these into two into one pill. They call it dicleges. It's the only FDA-approved drug for nausea in pregnancy. And it's 2 over-the-counter pills.
Or I could give you an over-the-counter antihistamine and a capsule of nicotinamide, and you have the same thing.
That's right. And so the bottom line is the reason that these health insurance companies, go back to the medical loss ratio, the reason that these drug companies are charging, literally, guys, they're charging $2,000 to $3,000 a month for these 2 over-the-counter tablets. Combined into one. The reason they can get away with that is the medical loss ratio. The health insurance companies pay these claims to get to keep 20% of that money.
Now, let me finish where I was going with this thought, Chuck.
Sure.
So I want Chuck to really grab this. Here's what happens. I'm a drug company. I start to make a drug. It's going to take me quite a while to develop that drug. Most of the drugs I try to develop will fail, but I've got a molecule here that looks like it's going to work. I now have to put that into 3 phases of an FDA clinical trial to get it approved. Those 3 phases can take anywhere from 3 to 8 years to get through. Now, keep in mind, I have a patent on this, and my patent's only good for 17 years. So I just burned up several years in FDA approval. I make it through FDA approval. Now my drug comes out, but it can be another 5 years before Medicare will approve the drug for payment. And basically, the insurance companies follow Medicare. Whatever Medicare approves, and the insurance companies tend to pick it up. So follow with me here, Chuck. I make this drug. I invent it. 6, 7, 8 years go by. I finally bring it out. 5 more years go by before Medicaid covers it. So now this drug's about 12 years old. And you come in my medical office, and I go, Chuck, here's the latest prescription we have for your stomach problem. It's 12 to 15 years old. Mm-hmm. That's how bad the medicine is.
And the patent will be up in about 4 or 5 more years.
Correct. And that's why. And that's why you have to charge so much for the drugs, because the drug companies have to recoup about $2.5 billion within about 5 years, because that's when their pricing window explodes when it becomes generic. So the drug companies are not always the bad guy, in as much as the system is rigged where they have to charge outrageous prices to be able to recoup the investment. Now, where I'm going with this, when you go to a doctor like Kevin, or you go to a doctor like Dr. Gladden.
Kevin, he does this all the time. He gets through where he's going with it and says, now where I'm going with this, it's an hour later and we still haven't gone to where he's going with this.
Well, what I'm saying is, because Kevin is not tied to the insurance company, he doesn't have to tell me to take the prescription that Medicare is covering. He can tell me, wait a minute, there's a new drug that's on the market right now. It's a cash drug, but guess what? We have a cash relationship. And this is the latest drug. So going to a doctor like him literally backs up the system, where the medicine I'm getting is several years closer to being cutting edge than it is going through somebody that's responding to a health insurance or to Medicare. Did I get that story right?
Yeah, well, yeah, in a nutshell, yes. But I will tell you this, most of the medications, routine, regular medications that I prescribe for my patients are the tried and true anti-blood pressure pills that I take, the thyroid medicine that I don't take, the cholesterol medicine, the even antidepressants, even a lot of asthma medicines, antibiotics. These medicines are all on a $4 list at certain pharmacies.
Some of those are. Now, I have a friend of mine who's a doctor. He owns a lot of clinics. He opened his own pharmacy. Mm-hmm. He's telling me that a prescription, if he wrote a prescription, gave it to a patient, and sent them to a drugstore chain, that the drugs that the insurance company is going to get billed $120 mm-hmm. for a prescription that he can fill for $11 out of his own pharmacy.
No, I don't believe that. No way. I had a patient come in when I was still doing emergency medicine. I had a patient come in one time, and she brought her kiddo to the ER and said that, last week my other child had this earache and or eye infection, pink eye. It was pink eye. And she said, last week I brought my other child to this Minute Clinic at CVS and said that I got seen by the nurse practitioner there, and they prescribed this antibiotic drop, and oh my gosh, we used them all, and I'm dreading how much this is going to be. And I said, well, this kid has the same thing. The pink eye is very contagious. So do you have any of those antibiotic drops left? You can just use those. She goes, no, that's why I'm here. I need another dose of antibiotics, but please tell me you can prescribe me something that's not going to cost me $160. And I said, lady, there are several types of antibiotic eye drops on the formulary at, another pharmacy that are $4 a bottle. But you're telling me they prescribed $160? Oh, let me guess. You went to a CVS where there's a nurse practitioner who prescribed the most expensive drug for you that you could walk over to the pharmacy counter and buy at CVS. Mm-hmm. Oh, I get that racket. And it's consumerism 101. If you're paying for this, and most people are these days, the average health insurance deductible is $2,000. So I have a saying. If you have a $2,000 or $3,000 or $5,000 deductible, congratulations. You're a healthcare consumer. Now start acting like it and quit relying on your health insurance to cover everything and just saying, what's my copay? Because it's going to get you nowhere except a lot of bills in the mail afterwards.
Do you have a network of doctors that you work with that do the same thing you do? I mean, it seems like this would be a great thing to start, is just a whole network across states, across the nation, cities, towns. I mean, have you ever thought of that, or are you doing that, or is that being done?
There are some organizations that are taken off. There's a couple of different ones. There's a Free Market Medical Association that is spearheaded by
free market, that'll kill it right there.
And there's a Direct Patient Care Alliance is another one. And these are organizations that are starting to take off across the country. There was a Direct Patient Care seminar in Florida back in October. And what's interesting is 300 docs from around the country came and attended that. So this is a movement that's going on. But I like to say this. It's being hailed as innovative and the new model of delivering healthcare. And
it's the old model.
And I would say that, man, this is just the way every other business in the U.S. does their business. I mean,
it's the way you used to go see the doctor.
Sure, it's a return to normalcy. Only we're not taking goats, okay? But the bottom line is that if you want to see a doctor,
leaves me out. I know.
Just kick Chuck out of healthcare.
Okay, we take chickens. But the bottom line is that if you have a high deductible plan and you needed some routine health care, the last place to look is to your health insurer. Now, I want to go down this thread, if I may. And I know we're not talking very much politics here, but politics underlies all of this. The political stuff.
Oh, we are talking politics.
It all underlies all of this. And let me tell you, employers are the ones who are really getting shafted. And that's where I'm focusing my efforts, is on trying to educate employers now to turn their wheels around, avoid the iceberg of collapse. Because
what can Mark do? You do this, Mark. You have insurance on all of your people.
Yes, we do.
It costs you a fortune.
It is a fortune.
And you do a show that's about living beyond 120. You've talked to Kevin before. What can Mark do? Let's bring it right home.
So I have this, and I'm not trying to tout myself, maybe I am, but I have this equation, this app on iPhone and Android that's good, that looks at health insurance. Let me explain this. Health insurance is sold through a combination of simplicity and complexity, and it's really all it is chicanery. And I want to point out that the way it's sold is that a health insurance agent, and I like to do my Texas accent for this, a health insurance agent will tell you, hey, listen, Mark, if you want to get your employees the bronze plan, that don't cover hearing aids, okay? But if you want to give them the silver plan, that'll cover a hearing aid in the left ear in odd-numbered years. But if you want to cover your employees with the gold plan, that'll cover hearing aids. Hell, you can put hearing aids in your dog if you want to with that plan there, Mark.
But can I put them in the goat?
You can put it, if you fit them. It might be trouble fitting them for the goat. But nobody told me this podcast was going to involve so many laughs. But the bottom line is that what's Mark going to do? I mean, Mark's going to pick the gold plan. I mean, come on. It costs more, but come on. You get 3 free doctor visits for only $1,200 more a year. Come on. So the way health insurance is bought and sold, and if you look at this, I have this equation I call Dr. W's equation. It's really simple. It's P plus O equals W. When people think of health insurance, they think of the wrong things. They do consider how much it costs them to buy it. That's the premium. But then they consider the deductible and the copay. And I like to point out that the deductibles and copays are nothing more than marketing tools used by health insurance companies to get you suckered. Because what you have to look at is you have to look at what am I going to spend on health care, not health insurance. That's what I'm spending on my premium. What am I going to spend on health care if I get hit by a train? Which the likelihood of being hit by a train is very small.
Now, we actually had an employee last year that was hit by a train. I am not kidding you.
I'm sorry. I'm sorry to hear that. I hope they're okay. But, there is a diagnostic
almost killed him.
There is a diagnostic code for that. So if you get hit by a train, that's your out-of-pocket maximum. That's what you're going to spend the maximum on. And if you start looking at these health insurance plans, it's really interesting. In my first book, again, I did a comparison. I logged on to Obamacare, onto healthcare.gov, and I screenshotted 10 different health insurance comparisons. I plugged in my data, plugged in the data for a family, and I looked at individual plans, employee plus or individual plus spouse plans, individual family plans. I did 10 different comparisons, and excepting very certain circumstances, like if you take very expensive medications, in most cases, people are losing money by upgrading. I'm not going to say that the bronze plan is always the best, because I can't make that claim, depending on your individual situation. But if you use this equation and look at it, you're really getting ripped off. I mean, in other words, I do every summer I do a post on my blog. I have a blog at healthcareonomics.com. And every summer I do a post about the Texas teachers, the teachers retirement system of Texas. And I point out that if me and my wife are in the front seat of a car, and Mark and your wife are in the back seat of the car, and we all get hit by a train, let's say, and we all survive, we do well, and we all have insurance through the teachers retirement system of Texas. Let's say that my wife and I in the front seat, let's say that Mark and your wife in the back seat, you guys are very responsible, right? You don't party, you save your money, you plan, you budget. So you guys got the gold plan, okay? My wife and I, we're pretty irresponsible. We like to party. We go to Vegas and stuff. So we got the bronze plan. We couldn't afford it.
Which is why you're being hit by a train.
Maybe.
There was a goat in the road. That's why he couldn't get across the track.
We're around it, Ossifer. So the bottom line is that what happens after all is said and done, and we've spent the money on our premiums, and we've reached our out-of-pocket maximums, guess how much more my wife and I are going to spend with our crappy bronze plan than you and your wife would spend with your great gold plan, Mark? We're going to spend $10,000, right at $10,000 less than y'all did. And the reason is because the insurance premiums are not only much, much higher for the gold plan, but the out-of-pocket maximums are higher for the gold plan. It's unbelievable to look at these plans side by side. And you look at these deductibles, the deductibles go down, but you end up spending $7,000 extra in premiums to take, are you ready for this? $2,000 off your deductible.
And now here's what makes it even worse, Chuck. So when it's time for health insurance renewal here at the office, so our broker comes in and he puts 6 different policies in front of me and 2 different versions from each company, and no one presents the same package. Mm-hmm. So now it's like, well, this one's a $1,500 deductible, but a $3,000 family, but it has a $10, a $40, and a $70 this. Yeah. It covers this kind of coverage. And you're looking, and now this plan here, well, this plan is $20 cheaper, but it doesn't have this, but it does include this. This is what you deal with.
It's worse than an auction.
Around the tree 15 times. Let me ask you the basic question.
Sure.
And that is, what should Mark do for his
Okay. So I'm getting to that. I'm sorry. I'm a little bit like Mark. I got to circle around to it. By the way, that's worse than an auction, trying to buy health insurance that way. So here's the deal. President Trump will bring this back to the political. Trump.
We've established that Mark's plan is crappy.
Right. So
the way it was presented to him.
There's help on the way. There's help on the horizon. Okay. First of all, there are things called medical cost sharing programs. And these are the Christian sharing ministries that you may or may not heard of.
I've seen these or heard these advertised on the radio, and I wondered about them.
Yeah, I think that, they're unregulated, which I hate that term, regulated, because it makes me think of big government, but they're unregulated. So you got to be careful. You got to do your homework on these things to ensure that, you're not going with a fly-by-night one that's just a Ponzi scheme. But there are some well-established ones. MetaShare is a huge one that's been around for years and years and years. But the problem with Medishare is it uses, if I'm not mistaken, it uses a large health insurance company's network. So I'm not sure how that ties in. I still think you have to go through whoever they say. But there's an interesting one that's out of Austin, Texas called Sedera. It's starting to take off, and it is a non-religious affiliated medical cost sharing program. It's pretty reasonable on its rates. The way they structure their deductibles, they call them individual unshareable amounts or initial unshareable amounts. I'm not sure, but Sedera is worth checking out for employers. I think it's going to make some big dents in health insurance as time goes by.
So they across states or just for the state of Texas?
Well, it's a local per state thing. No, it's available nationwide. But buying health insurance across states, I did a podcast with a health policy expert last month on why health insurance really can't be sold across state lines. That's another topic. But these medical cost sharing programs are something you ought to look at, Mark. But what I was going to say is that President Trump signed an executive order in October of 2017 working with Rand Paul, who's one of my favorite politicos. And they came up with this idea of association health plans. They're not out there yet. They're being worked on. In fact, I'm involved in an endeavor to try and get something like this started for employers. And what it's going to involve is employers become truly self-insured, where employer puts money into this bucket, and then out of that bucket comes healthcare costs. Whatever's left over at the end of the year, the employer either gets to keep, to retain in the account, to use it to offset next year's premiums, or to take back or what have you, minus an actuarial reserve. So the bottom line is help is on the way. Things are changing, but we got to start thinking outside the box. We got to stop thinking about, what your health insurance broker's telling you about these 8 different plans or 6 different plans and involving, putting things in goats. But we got to get off that.
Think about what Vladimir Lenin said about healthcare.
Mm-hmm.
I mean, it is so important to understand exactly where the Marxist, communist, socialist, progressive comes from. And that is, it is the keystone in the arch of socialist government. It's
right.
What holds everything together. That's
right.
how important healthcare is, and that's how badly your government wants to take it over.
Well, it gives government the power of life and death.
Well, that's what happened in Europe after World War II. Modern healthcare was ushered in. Again, we went from an era without antiseptics, analgesics, anesthetics, antibiotics into an era where now we can actually help people with healthcare.
This is a whole thing that happened in Europe.
Took it over.
When the Marshall Plan came along to rebuild everything in the Second World War, what we basically did was put Europe on welfare.
That's right.
We did. We put every European on welfare. Right. And so they just continued with the welfare state after we left off of the Marshall Plan.
And, those socialist governments grabbed control after war-torn Europe. They were rebuilding everything. Healthcare was an easy pick because it was new, it was modern, it was something that had not been controlled before. And they managed to convince
came along.
Yeah, and they've managed to convince everybody that you can't get healthcare in France without the government. Well, do you guys know that there is a thriving private health insurance industry in Britain?
No.
There's a thriving private health insurance industry in France. Oh, yeah. And you know why people buy these health insurance plans? Is so they can get in to see their doctor, of course.
Right, because it's
Canada. Canada as well?
I'm not aware.
Right next door to us.
Canada's different. Canada, it's illegal to go hire a doctor direct.
Oh, really? Illegal?
Yes.
Well, they don't have a private health insurance program. I know that.
Yeah, you can't go pay a doctor cash in Canada.
Yeah.
Well,
yeah.
Interesting.
So it's crazy. I mean, but even in Europe, where socialized medicine is the norm, there's a big myth of healthcare, and that is the idea that we need health insurance. So, National Health Service doesn't cover a doctor visit, or can't get in to see my specialist soon enough, so I'm going to buy a health insurance plan to allow me to do that. It is the craziest thing I've ever heard of.
I think it's fascinating that people can push the idea that government can do healthcare better than the private sector, or government can do anything better than the private sector. I find that just amazing that people would buy into that, knowing how terribly inefficient government is. And that's not just a quack criticism of them.
Sure.
They literally
it's the
can't do anything
mindset.
right, pretty much.
Think of this. You go out and you buy a new Mercedes, which, of course, Chuck, he drives a Mercedes. He gets a new one every month, I think.
Every month.
So
You get a colonoscopy.
I get colonoscopies. So you go out and you get that new Mercedes, you bring it home, and the neighbors come over and they're looking at it, and they're looking at what a fabulous car it is, and 12-cylinder. And then you say to the neighbor, Well, you think the car is great. You should see my car insurance. We don't do that. We don't brag about our car insurance. But now think about what Chuck said. Well, I had SAG-AFTRA. I had the premium insurance.
Yeah, great health insurance.
We think of insurance as being something that we should be looking to get the best of.
The most out of
Well,
it. Right.
look, I was part of that privileged class in Hollywood who belongs to those particular unions that really took the gold standard they considered gold standard people. And back then I was considered that. Of course, it stays on with me because I'm a member of SAG and AFTRA and have been for all these years. But
think about the thinking, though.
I know.
Oh, it's all psychology. What this boils down to, it's all psychology. I like.
You don't buy the gold plan. When you get your car insurance, they don't tell you, do you want the gold plan or do you want the silver plan?
And you will do anything to avoid filing a claim on your car insurance.
Right.
So the way I like to say it is the health insurance industry is comprised of geniuses. I mean, these people are so genius. I have this series of small little 1-minute videos I put out.
Is the word genius or is the word diabolical?
Well, diabolical genius. What do you call a company that can get you to pay it $1,500 a month just to avoid paying $100 for your doctor visits? Genius. That's what I would call them. In fact, they're so genius, if they had worked for NASA back in the 50s and 60s and 70s, we'd be colonizing far-flung solar systems by now. They're genius. They've absolutely taken and hijacked psychology so that made people believe that this third-party payer system not only is a good thing, but you're dependent on it. You're fixated on it. And what myself and many other physicians are trying to do is to just bust that myth, just break that idea.
Well, I tell you what, the best way to do that is, I don't know how to say this, but I want to wrap up with this. The best way to get your message across is to simplify. And that's what most people don't do. I'm not accusing you that or anything else, politicians or whatever, but most people just don't simplify to where people can grab it right away and understand it, and then pay the price for the difference. I mean, you have to do that. You have to. It message is everything. That's why the Democrats and the progressives and people like that are so good. All they do is study messaging.
Yeah. I have a series of videos on my YouTube channel. They're about a minute long. Each one of them is a short, little, brief lesson. It's exactly what you're talking about. And in one of these, just to give you an example, I say, you wouldn't let a health insurance company pick what goes on your pizza. So why do you let them pick which doctor you get to see? That's a great question. I mean, when you think about it, it's like, why do we do that?
Well, you know, those minute YouTube things, I love that. I love Prager University. I love that site. It's great because it's like 5 minutes of incredible, wonderful information on history and whatever's going on today. So those
Don't you think most people spend more time deciding where to buy the pizza and what to put on it than they do deciding what doctor to go see?
That is a great point. You know, that's a great point. Managed care, what managed care did back in the 70s and 80s, and I'm talking about the advent of copays, what it did was take away your Marcus Welby. I think we're all old enough to remember who Marcus Welby was. Took away that sacred relationship, somebody that you're supposed to trust and believe in, and turned it into, well, gosh, Dr. Welby, you're charging $20 and they're telling me I can go see Dr. So-and-so for 10.
But now,
amazing.
Here's a book. Find a doctor in the book. That's the list. This is the list of doctors you can go see.
Right.
You don't know if that doctor's good, bad, or what.
They're controlling your process, your whoever you want to see. It's control. It's just
controlling your life.
If you use health insurance, employee or employer, if you're using health insurance to get your health care, you're doing three things. You're allowing the health insurance company to tell where you go to get your health care, when you can get your health care, when they approve it, and most importantly for these high deductible plans, how much you are going to pay for that health care.
I love the fact that they want to protect you from seeing a witch doctor. As if you can't be responsible for your own life. I mean, give me a break.
That's right.
Thank you for coming on the show. I really enjoyed speaking with you.
I appreciate it.
I really did.
And folks, we'll have links to Kevin's books and his website and to the YouTube videos and stuff all in the show notes at bluntforceTruth.com.
Start with those 1 minute videos. You ought to see those. In the meantime, Kevin, thank you so much. We'll have you back if you're willing to come back after all this.
Absolutely.
Fun we've had today.
You bet. Absolutely. Anytime.
All right. Thanks, everybody, for listening. You've heard the Blunt Force Truth, and get ready for the next one next week. We'll see you. I'm Chuck Woolery saying goodbye and good luck and God bless.